Ahead of Colorado's first doses of the COVID-19 vaccine, you might be wondering about the side effects of the drug. KRDO News Channel 13's Jen Moynihan is live outside the Lynn Institute, which is leading clinical trials in Colorado Springs for one of those vaccines. Jen.
Heather, fever, chills, body aches, and fatigue, those are just some of the most common symptoms reported by recipients receiving COVID-19 vaccines. But according to both state and local health officials, the process of building up that COVID-19 immunity also plays a role.
While it's important that it works, it's as or more important to be sure it's safe.
Safety is top of mind for health officials as Colorado prepares for its first doses of COVID-19 vaccine.
We'll hear about fevers, fatigue, headache. These are symptoms that affect the whole body system.
They say the process of building immunity can also contribute to symptoms similar to the side effects seen when administering the flu vaccine.
This vaccine definitely stimulates the immune system.
Dr. Ripley Hollister at the Lynn Institute in Colorado Springs agrees. He says that's a common effect they're seeing currently in their Moderna vaccine trials.
People a lot of times don't understand that when we stimulate the immune system, it doesn't feel good. I a lot of times will see patients saying, I'm going to feel better if you stimulate my immune system, but you don't.
Of the 270 active participants, Dr. Hollister says half are getting the vaccine, while the remainder receive a placebo. But he says it's fairly easy to tell who's getting the drug based on what each participant is experiencing.
They tended to be mild. They tended to react a little bit more to the second vaccine, which is administered 28 days after the first one.
That's also the case according to new data from Pfizer, which shows 4% of participants who received the first dose reported having a fever. That number increased to almost 16% when after getting the second dose.
It seems to be a common theme that with the second dose, the reactions are greater.
Now, state health officials also warn that people who have a history of increased allergic reactions to medications or other vaccines may also have an increased risk of allergic reaction to these vaccines as well. Reporting in Colorado Springs, Jen Moynihan, KRDO News Channel 13.
Very interesting, Jen. Thanks.